Hello, everyone, and welcome to the Way of the Psychonaut and our second question and answer session with Dr. Stan Grof. Before I invite Stan to join us, I have a few simple instructions to support you on our call today. We warmly invite you to come on audio and or video to speak with Stan. To do this, and I see some of you have already, click or tap on the raise hand button on your computer screen or mobile device. After you've raised your hand, you'll go into the queue. And when it's getting close to your turn, you'll see a message that says the host has promoted you to panelist. Then your screen will look like it's collapsing. Just allow that to happen, and then you'll be backstage. And when it's your turn, we'll call on you by name and we'll unmute your line. Everyone will be able to hear you. Only Stan and others backstage will be able to see you if you have your video on. We also invite you to type in your questions using the Q&A button that's right beside the raise hand button. If you're on a mobile device, tap your screen and the Q&A button will appear. And I will then read your question aloud to Stan. Please keep your spoken and written questions clear and concise as possible so we can include and respond to as many of you as we can. We invite you now to start raising your hand and submitting your questions to get us queued up. And now let me invite Stan to join us before we get started with the first question. Welcome, Stan.
Hello, everybody. Welcome to the Q&A module. I'm sure that very many questions and comments have arisen in the last few modules. So I'm very, very curious which direction we'll take it.
All right, wonderful. So let's get started with our first question. So our first question today, Stan, comes from Teresa. So Teresa's question, and Stan, I'm just double checking to make sure you can hear us. Wonderful. So Teresa is asking, what is the part of the birth matrix that would cause the reiteration of hoarding?
Well, I don't think that we can relate everything to the birth matrices. I think a significant part of the hoarding has to do with self-image, and the self-image would certainly have a lot of input from a postnatal biography. You know, what the story was, what the interaction in the family was, what happened to that person during school, the reactions of the schoolmates and so on. And the sense of inferiority is then anchored in the third matrix when the life of the fetus is threatened because of the choking, of the pain. There's tremendous fear and certainly sense of inadequacy to cope with that overwhelming situation. But then also the life is threatened, so there's enormous drive to save oneself, to get on top of the situation. So I think I mentioned when we talk about Adler that this sense of inferiority and the tendency to overcompensate it is linked to that third perinatal matrix. But I think we would have to take into consideration the whole history of that person, postnatal as well as perinatal.
Okay, great. Thanks, Stan.
That there would be even a transpersonal past life kind of connection. This would have to emerge, you know, during the process of self-exploration.
Great, thank you, Stan. Let's go to someone who is ready to speak to us. And you can see, so this is G, and I'm just going to refer to you as G, and I hope you'll come on, speak with us. Are you with us?
Hello?
There you are, wonderful. Maybe you can share with us your full first name.
Yeah, my first name is Guðmundur, but I use Ragnar for people that don't speak Icelandic.
Wonderful, thank you so much.
Hi.
Hello. I had a terrible time last week. It was very difficult for me. I recognized in these pictures you were showing us things that I related to, but I'm very grateful even so. But the question is, being triggered and feeling pain is something that I recognize. But now I'm wondering, is it possible that I will be triggered and perceive it as a good experience, but still seeking to be triggered for something that I perceive as a good experience, but it's not really necessarily a beneficial thing. It would be like seeking for some kind of good feeling through seeking triggers like excitement or something like this. Because I recognize the triggering generating pain, but not, I assume that this also can represent as being some other way of escape. This is what my question is.
Do I understand correctly? You're talking about experiences in everyday life or experiences when you are involved in some holotropic state of consciousness?
In the holotropic aspect, it's all much more like perceived as what is experiencing now, and I'm working on it, and everything that happens is a schooling, is a learning. But in everyday life, I sometimes get triggered and feel pain from a circumstance. But then I was experiencing, I get triggered to get some kind of comfortable, numbing feeling or something like this, not experiencing it as pain, but it just maybe triggers me to go to some kind of escape.
Well, you see, emergence of any kind of symptom, whether it's pain or anxiety or sadness, basically signalizes that something's emerging out of the unconscious. So underlying the sensations that you would have spontaneously in everyday life would be some kind of an old trauma that you experience. And then I believe that in holotropic states you would find those, and you would then be able to fully comprehend what it is, where it is coming from. You see, whereas if you are in everyday life, it's filtered through what we call defenses, psychological defenses. So a symptom is like a compromise of something that's trying to emerge from the psyche and the forces that are holding it down to protect us from that.
Yes, yeah. But it's like I'm seeking to generate behavior in people that will make me feel better. This is why I'm saying, am I seeking for triggers to, even though I'm running away from triggers that give me pain, I will also be in a situation where things are like triggering things inside me that I think are beneficial, but they're not really necessary. They're just some kind of deep mechanism that's going on.
Yeah, I think I also talked about the two-way interaction between the systems of condensed experience, the COEX systems, where on the one hand, if you are under the influence of the COEX, you would be experiencing certain things from the past. You would be also perceiving the world somehow in a way that reflects that past experience. But also if something happens in the external world, it tends to activate your COEX system. I gave that example when we were running a session and the dog was barking outside, and it brought my patient right into the experience where the barking of the dog was an important part of the environment. So I think this is also something to look at. Your interaction with the environment could involve the COEX dynamics.
Mm-hmm. Thank you.
Yeah. Okay.
Thank you.
Thank you so much, Ragnar. Thank you for joining us on video. All right, let's go next to a written question from Nadia. Nadia actually has two questions. We'll start with one and we may get to your other question later, Nadia. Nadia asks, how did you link the imagery you see in a holotropic state with the birth process? For example, how did you know that the imagery that corresponds to the birth process corresponds to that and not to something else?
Well, typically in the experiences of the perinatal matrices, you can get both. You can have the stage of the birth that you are in as a fetus, and then also selective opening into the collective unconscious, either the historical or the archetypal. So the patient themselves told me that these things were happening either simultaneously or alternating as they were dealing with these different matrices. So this is not some kind of a theoretical speculation on my part. I was there just as a chronicler. I was collecting, people's observations, people's insights, and this is what I then put in the books or into the papers. It's very different from doing, verbal psychotherapy and then bringing some kind of an interpretation. Here it comes in the form of very vivid experiences where it's not a problem to realize what is happening. But the information came from my patients to me. It's not my creation of any kind.
Okay, Stan, and next we have Franny. Franny's here with us backstage. So Franny, welcome. Your line is open.
Hi.
Hi, hello Stan. It's really wonderful to get this opportunity to be with you. What I want to share with you is something that you might find interesting, and I think the community will. A little bit about my background. I did work with LSD in the 60s. I trained as a psychotherapist with do you know anything about David Grove, who works with clean language and developing somatic metaphors from where they're held in the body?
No, I don't know.
No, he's dead now, but he was amazing, very elegant. I also spent 20 years in a spiritual community, which is an important part of this. But I'm very psychoactive at the moment, at the same time as my son is having a psychotic break. And he is bringing up material that we find very relevant. It's all to do with the feminine. He has these waking visions where he pulled a little girl out of a well who was dead, and the spiders and all the usual stuff. But the important part that I'm trying to get to is when I was pregnant, I received a powerful spiritual initiation. And my teacher felt it was okay that I was pregnant. And at Christmas...
medicines, yeah?
Pardon?
It involves some medicines?
No, just transmission. Just transmission. That's all, just energy. But I did have a big awakening whilst my son was in utero. And at Christmas, my son has finally pushed me away for a while, and he was absolutely furious about my having done this when he was in utero. He can't, I don't think he's actually remembered it, but of course I've told him about it. But he feels this has brought us far too close, and that this has been very damaging for him. He feels that he really is unable to keep out all this deep unconscious stuff, which is now pouring into
How
him.
old is he?
He's 27.
27.
Yes.
And he's also involved in some intense self-exploration?
No. Well, yes, but through smoking cannabis, and he's never really done very well. He got very sick at the age of 12 with chronic fatigue, and he's had a really tough time. But what is interesting is maybe even a good intervention can, and who's to say what is good or bad in the end? I mean, this could be lifetimes old, but even something like a spiritual awakening can have a big.
Are you asking some
effect.
questions, or are you just telling us the story?
No, please, I just wanted to give you as much as possible.
Yeah, I understand.
Mm.
But what would be the question? That
I just wanted to bring that to you and ask you if you'd come across it before, that something like a spiritual intervention on the mother's part has caused trauma.
In holotropic states, anything that happened to the pregnant mother can be perceived by the fetus, and whether it's very positive things or negative things, for example, toxic influences of some kind, physical traumas, things like concussion and so on, mechanical forces of some kind. So I have a long list of situations that my patients and clients described that we could actually verify that those things happen. So there is a very sensitive organism in the womb that certainly can pick up these things. Sometimes it seems that there's even sort of telepathic awareness of what is happening around the pregnant mother. So that's, it's very likely, depending on, if you elicited some kind of intense experiences in you, there's certainly a transversal connection, but there's also real biochemical connections through adrenaline, noradrenaline, sexual hormones, endorphins. All those things are shared with the mother and the fetus, so that will be communicated even biochemically, not just necessarily telepathically or psychologically. Now, think that I wanted to bring to your attention the really interesting role of archetypal astrology. I'm planning to bring Rick Tarnas to one of our later sessions, who has done 30 years of this, over 30 years of the research. And there is a really fantastic correlation between what's happening in holotropic states and the planetary transits. So what you're saying, 27 is very close to what's called the Saturn return, which is a 28-year orbit. And those are very, very powerful influences. You find it in many people who have spiritual emergency, that it's happening at this particular time. And I think you would find it very interesting to connect with a good astrologer and get a reading, and then see what kind of insights you can get, both to the timing of these kinds of episodes and the archetypal content. I would suggest Matthew Stelzner, Stelzner, and the email, and you can reach him, is mstelzner@aol.com. And if you tell him that I recommended that, I think you would get some very interesting insights into what's happening.
Yes.
What's happening to you at the time of what you call the initiation. If you remember the time, I think archetypal astrology could really throw some very interesting light on it.
Yes, I am an astrologer, so
you
I'm
are.
I'm very aware of everything.
So
And
sorry, I'm.
it's okay. Other
bringing
people
all to
also
Newcastle, yeah.
also need to hear this. And there was a massive part of synchronicity last week. Looking at all your images, it was my son's birthday. So on the birthday when I gave birth, I'm looking at all these images from your last week. My North Node is on your Uranus, and you're having your Uranus return. So this is part of why you're being so helpful for me at the moment. And I'm
Thank
very
you
grateful.
very much.
Thank you so much, Franny. Thank you so much. All right, let's go next to a written question from Frederico. And Frederico asks, I would like to ask if, Stan, you could recommend other authors similar to Ivor Brown, and if you could go deeper in the idea of psychological trauma, unexperienced experiences, and dissociation.
I think Ivor Brown's article, is probably the most complete report on what I have seen in regard to the question why are experiences re-experiencing of why is the re-experiencing of traumatic events a healing, not a re-traumatization. And he gave a very interesting answer to that actually, if we are in some major traumatic situation, certainly birth would be that kind of situation that is overwhelming psychologically. We are not really fully in it with our consciousness. We know, for example, from near-death situations that consciousness splits, and why people are hurting in their body, maybe have fractures and so on. The consciousness splits, and they're watching it from above and can even have a beautiful transpersonal experience, spiritual experience. So, we go through that trauma, but we have not really fully experienced it, and certainly have not processed it emotionally by releasing the pent-up energies and the pent-up emotions that this kind of trauma generated. So he talks about it as the unexperienced experience. Sometimes people, when they are in a very overwhelming emotional situation, they can actually swoon. They can completely lose consciousness while those things are still happening to them. And then, of course, you have the other situation, which is that the therapeutic situation, in a way, experientially is close to what happened to the child. But now it's an adult with a whole other perspective, whole other understanding, different kind of stamina that is there to support the inner child in going through that experience, this time fully. So I really don't know any better paper than Ivor Brown's. There's certainly a lot of things written about traumatic experiences as such, but if you are specifically asking what Ivor is addressing, the inexperienced experience, and why is this healing rather than re-traumatization, I think this would be the best source. There are people who work on trauma in a different way. For example, Peter Levine, who does not let people to experience it fully with the breathing, but lets them sort of have a little of the experience and then step in and process. So, there are different ways of going. I believe that if it's an intense trauma like birth, that you cannot do it piecemeal. You really have to reach not just the quantity of the emotions which are involved, but also the quality. If there's a really high level of tension before the birth happens, you have to match it. That's in terms of the depth and the quality of the experience to actually make that experience fully conscious.
Okay, let's go next to Marina. Marina, welcome. Your line is open.
Hi.
Hi.
I have a question. I wanted to bounce an idea off of you concerning the current and future use of ibogaine for inner work. In my experience at the ibogaine clinic, it was very medically controlled and I felt very safe, but I was unsupported psychologically. Looking back now, I feel like it gave me direct access to the transpersonal realm, but I had no one at the time to integrate my experience with. So what do you think about the possibility of blending your work with holotropic states with the medical model currently used in ibogaine clinics? Do you think it could be a modern day alternative for LSD therapy?
Well, it could, but like with LSD and or any other psychedelic, you know, psilocybin or mescaline or DMT and so on, the people who are doing it have to have a large cartography of the psyche. You cannot do effective work with psychedelics using the current model, which is limited to postnatal biography, because the very powerful and important experiences happen on the perinatal level in relation to birth, and then of course on the transpersonal level, the karmic, the archetypal experiences, you know, mystical experiences. So you can't use a model which treats spiritual experiences and mystical experiences, karmic experiences as being products of psychosis. We have to really change the whole paradigm in psychiatry to be able to work effectively with the holotropic states. This is working with holotropic states is not a chemotherapy. You see, if we worked with chemotherapy or pharmacology, we would have to know exactly what we want to achieve. You know, this is the essence of pharmacology. I have to know that if I give this substance to my client, there is a good chance that they will sleep if they have insomnia, or if they are agitated, that the tranquilizers will calm them down. With psychedelics, you never know what's going to come. You know, you can anticipate it somehow, as I mentioned, through archetypal astrology, but you will never know exactly what's happened. Then I realized in our early work, where we were doing sort of laboratory research, at a certain point, we were not doing psychopharmacology. We were activating the psyche. It's a deep psychological work. And if you have people who give psychedelics and they don't have this understanding, which is a large cartography of the psyche, the idea that the roots of the emotional problems and psychosomatic problems go farther than infancy. They go to the perinatal level. They go into the transpersonal level, archetypal, karmic, and so on. If they don't know anything about the self-healing intelligence that happens in psychedelic sessions, that they're not going to be doing very good therapy. This is not just the chemical effect. The psychedelics are tools. We will actually have one of the future modules just on the set and setting. What happens with psychedelics critically depends on who gives it to whom, for what purpose, and what is the physical environment, what is the interpersonal environment. It's also important to know something about the history of that person in terms of the coexistence and birth and so on, because those are things that can come up. So, you know, the work with psychedelics has to be psychotherapy that uses psychedelics as an adjunct. This is not chemotherapy. Does it make sense?
Yes, that does make sense. Where is the current research on legitimizing these states and breath work? Where is the, research on it right now?
Well, you know, there's as far as holotropic breathwork is concerned, there's only the information that's coming in the sessions of people who are in the training or people who come to the workshops. I don't know of any research, you know, that would try to really validate this. So there are a lot of anecdotal reports, but I don't know. We have number of papers that people did, and if you want to look at it specifically about holotropic breathwork, they are listed in our book, When the Impossible. Holotropic breathwork, in the book Holotropic Breathwork. So the dissertations that people done and the papers that people have done, but I don't know of any like an academic research that would be happening, because you know, before you would have really research in academic circles, you would have to accept the changes, the conceptual changes. You would have to use a new paradigm thinking about the psyche and consciousness, rather than using the monistic materialistic approach to psychiatry that believes that there's nothing of relevance that precedes the moment of birth, including birth itself. There's no recognition that birth is a major psychotrauma. And certainly there's no recognition of the transpersonal level. Spiritual, mystical experiences are misdiagnosed as psychosis. You know, the whole concept of a spiritual emergency talks about it. And these the powerful holotropic states of consciousness that have healing, transformative, heuristic, even evolutionary potential. And when people are admitted in a difficult situation of this kind, they would be treated as psychotics, as people having mental disease, and they would be treated by tranquilizers. There's no concept of a mystical experience or spiritual experience in current psychiatry.
Well, let's make it happen. Thank you so much, Dr. Grof. Have a great day.
Okay.
Thank you, Marina. All right, let's go next to a question from Tom. And Tom asks, how would you advise someone like me who has done 4 breathwork sessions, the first including an amazing experience of numinosity, a sense of being one with the universe and flying through it, accompanied by sheer bliss and happiness, and the next 3 sessions being essentially blank or devoid of any exceptional experience, either good or bad? Am I trying too hard or expecting too much, or is there perhaps nothing there and I'm fine?
Well, I don't think that there's nothing there. You know, there's the archives of the psyche are enormous. So you might not have any major traumatic experiences in your childhood or later life, but you were born. So, you know, there is certainly that record, and you know, the process of being incarnated itself is a trauma. So there would be things on the transpersonal level. So you have to look at why it didn't happen. One of the reasons that it might happen is if you are coming into it with too much determination. What you want to experience? You want to have another blissful experience, or you want to have a past life experience, or you want to relive birth. We always tell people, you know, that they should not bring any kind of plans, any concepts into it, what they would like to experience, what they would rather not look at, and just really allow that spontaneous healing intelligence happen. Now, if you have the feeling that you're too much in your head, sometimes it helps to use a mantra. You don't have to say it. You can just sort of do it in your head. We have done a lot of work with a sort of ancient Indian mantra, which is Hamsa. Hamsa in Sanskrit means swan or gander, and it's the symbol of Brahma. And if you repeat Hamsa, 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 Ham, then after a while it becomes Saham, which means that is me, which is you're repeating I am Brahma. But the most important thing is you keep your mind really busy by doing the mantra, and you don't have time to do much analysis. So it's a very, very useful way of approaching it if you feel that it might be something that's has to do with being too much in your head. That Hamsa also tells you is inhalation and Sa is exhalation, so it will tell you how to do that. The other thing is, you know, to really surrender to the experience, whatever it is. Not to want the experience that other people have. We have seen situation which was the opposite to your blissful experience, where a person is watching, you know, with a lot of attention and then discomfort, other people who are kicking and screaming, and they themselves are moving into a deep state of relaxation. And they might have the feeling, you know, those are really doing the work. The movements and the screaming, that's really what should be happening. And I'm just relaxing here. So whether it's taking you one direction or another, it's really important to surrender to it. The other situation, I don't know how far apart these experiences were. Again, looking at archetypal astrology, you know, there are transits which are very, very conducive to powerful experiences. Like if you have, let's say, Pluto-Neptune transit, you know, that would be something that would be associated with very powerful experiences. There are others that are not. Saturn, for example, generally tends to bring inhibition into the experience. So people who have strong Saturn natally, they usually have more difficulties of letting go, and also having some powerful Saturn transit could be blocking the experience. So I don't know if you know your chart or if you have done you know, astrological reading, but again, I would, for anybody who does some really significant inner experiential work, I would recommend that they know their chart and they know the transits at the time when they're doing this work.
Thank you, Stan. We'll go next to Sierra. Sierra, welcome. Your line is open and we see you.
Hi, thank you so much, Stan. That was a great segue to my question. I feel like it's related. My question is about ayahuasca. My husband and I have tried ayahuasca a couple times, and of course you hear all these great experiences or even terrifying experiences, but he and I both have had very mild experiences, very mild visual, and if anything, my own experience has been more kind of just like a deep knowing, as opposed to something being shown to me. And I'm just I'm still curious about learning from ayahuasca, and I want to know if it's possible to have that experience, or maybe it just doesn't work on some people.
Well, again, you probably took it in a group, because ayahuasca is frequently done in groups. So it means there were other people who took the same amount and they had powerful experiences. Yeah. This was not an isolated experience of the two of you. So I think what is important to know that there are different kinds of experiences that can be very important. It doesn't have to be visions. Many people feel that visions, you know, make the experience. And, you know, many of the visions can be abstract. They're sort of aesthetically beautiful, but not really, you know, very, very important in terms of your self-exploration. So if you say deep knowing, we would have to talk more about what that was. That could be an extremely profound experience. It just does not come with fireworks, you know. And many people have that. They think if they didn't see something that they did not have the experience, that they might go through powerful build-up of physical tension and releases, or aggression is coming, but if they don't see pictures, they tend to discount it. So it's really important to know that there are powerful experiences that are not visual, that come through some other channels. And there are even people who have more disposition for visual experiences than others. You know, and you know, a lot of people have certainly visual experience. If you look at the ayahuasca paintings and so on, you know, they are very, very, very colorful. But deep knowing, what comes to my mind is something that's said about the Vedas and the Upanishads, that you can receive knowledge of knowledge of that, the knowledge of which gives you knowledge of everything. So it's not like you learn mathematics or get some information about the material world, but you can get insights, what's called prajna paramita, you know, what about the nature of existence, or revelation of who you really are. Those are very, very powerful insights that can come, and that doesn't come in terms of visual images. It comes as sort of intuitive access to knowledge. So again, we would have to talk more about what you call deep knowledge, but you know, the very, very important experiences can come without any visual accompaniment.
Thank you.
Great, thank you, Sierra.
Just the last thing. For example, people can have extremely powerful experiences with MDMA, and the MDMA is nowhere as visual for most people as, let's say, mescaline or LSD or psilocybin, and they can have life-transforming experiences. You know, it's now being used for PTSD, for the post-traumatic syndrome, that doesn't respond to anything else, and people can go through powerful healing and transformation, but not have a lot of visions, you know, or they somehow on the verge of active in the imagination, but not really technicolor, you know, intense visions. Okay.
Okay, super. Let's go next to Summer. And Summer asks, do you see the mechanisms of psychedelics as being exclusively neuroscience, or are there additional energetic spiritual mechanics at play other than neurochemistry?
Well, you know, to understand what's happening in psychedelic sessions, it's not enough to know something about the brain and the neuroreceptors and the neurotransmitters and the antagonisms in the brain and so on. Actually, the key to understanding what's happening in psychedelics is some other disciplines. It's much more philosophy, mythology, comparative religion. You know, once you know that people are healthy who go into psychedelic therapy, you don't use much medical knowledge. It's much more important to know depth psychology, to know comparative religion, to know something about philosophy. Mythology is extremely, extremely important. So to know, you know, what is happening in the brain, I see it as a separate, very important, very interesting discipline, but something that doesn't contribute a lot to the active work with psychedelics, the healing with psychedelics.
Okay, thank you, Stan. We go next to, I think this is Shanti Lily. Welcome.
Hi, Stan. It's Shanti. Yeah, and happy Ruby Tuesday to you.
Yeah, thank you.
Yes, thank you. And my question is about brain physiology. I know someone who had a total psychotic break. It was a bipolar 1. There were 2 months, 8 weeks when she was allowed to do anything she wanted to do or say, was able to work out a lot of, had some major breakthroughs in this very deep psychosis. But then it came to a time when she was given lithium after two months of processing in the manic state. And the lithium, of course, took the delusions away, as it will. But what happened, of course, was there was still leftover hypomania, which is almost as bad. And there was needed Seroquel, and then there was needed a sleeping pill, and there was needed an antidepressant too. And there are those. Now, I was told that when a person's had a major break, that you can see it in the brain, like physiologically, that the brain is never quite the same. And and so the need for those drugs seems to exist. And with bipolars, there's often, they go off their meds when they feel okay, and then they go nuts again. And those who are med compliant stay on them. So I want to know what you think of the physiology involved in the brain, and whether the meds are necessary for that reason, for a physiological change in the brain after a severe total psychotic break. Do you agree with the physiology part and with the med part, or what is your feeling about that, all of that? I know.
Okay, so I'll approach it from 2 different sides. One is the healing potential of the holotropic states. Okay, so you probably know that my late wife, Christina, and myself came with the concept of spiritual emergency, the idea that many of the states that are currently diagnosed as psychotic are better understood as crisis of spiritual opening or transpersonal crisis. And then if they are properly understood, properly supported, then they actually can be healing, transformative, evolutionary, and so on. So one of the things that would be important to see how that person would be responded if we work with them, if we actually let them to express more of what is happening, and seeing it as an experience where the organism is trying to get rid of something. This is the essence of homeopathy, that if symptoms develop, those are actually expressions of the self-healing impulse. So homeopathy is trying to actually temporarily intensify or deepen the experience because you're supporting the healing, the healing intelligence of the psyche and the body. So that's the first one. Again, we don't have that concept in current psychiatry. We would have to radically change the thinking in psychiatry, expanding the cartography, where we realize that the perinatal level is a normal dimension in the psyche, that there is this vast transpersonal domain. So when people have experiences from the perinatal level and from the transpersonal level, it doesn't necessary to see it as pathology. And there are very powerful memories that can come up. Memory of birth can be a very, very stormy, dramatic experience with a lot of screaming and shaking and coughing and flailing around and so on. But that doesn't mean that it's pathology. If we know what the trauma is that the person is processing, we will be able to support it without the notion that this is a psychotic state. The same, people have powerful past life experiences, or there's some archetypal material that's coming through. And you have to be trained to work with these states in an alternative way. So that's the first one. The second one is my brother Paul actually works in Ottawa, and he has spent a lifetime studying affective disorders, bipolar disorders, and so on. He was the one who, with a group of people, returned lithium into psychiatry after it was temporarily stopped. And they study biorhythms and so on, and they have a longitudinal study of whole families that's going on for decades and studying the rhythms. And you can actually administer lithium in such a way that it prevents the episodes, and you can actually medicate people only at a time when they're particularly inclined to have that episode. Lithium, in my understanding, is much more subtle effect. It's not like snowing people with tranquilizers where you really block the experience. This is a much more subtle intervention in the biochemistry. We, for example, have always allowed people to do holotropic breathwork if they remained on lithium. They still have powerful experiences, but they don't have a manic episode. So that's another part of it. The other thing is there are a lot of wonderful studies of the brain, imaging of the brain, showing what's happening to the brain in LSD sessions, and actually shows much more interconnections are happening than under normal circumstances. So that again, that doesn't mean if you find some changes in the brain, that doesn't mean that it's necessarily pathological. Now, there would be definitely changes after powerful holotropic experiences. For example, I had EEG taken, electroencephalography taken as part of my first LSD experiment. So I have a record of where I started. And now, if you do an EEG on me, I will be completely in a theta state, which means my EEG is permanently changed. And when I was studying medicine, to be in a theta state, you have to be in deep sleep, or in a coma. It was not seen that you can function in a delta state. And yet there are many people whose EEG is permanently changed. And the way I understand it, if you have a lot of traumatic experiences that you carry in your unconscious, they are associated with fast frequencies. And so if you process these, if you get rid of those traumatic imprints, that you are moving towards slower brain waves. And again, it means really deeper relaxation, the movement to much more tranquility, much more sort of easier functioning, that you're not driven by energies. I used to have energy that I never thought that it was pathological. I just loved life, but I was driven in life. Were always all the books that I wanted to read, all the things that I wanted to do, and there didn't seem to be enough time. And through the psychedelic experiences, I got to a situation where the energy is available when I need it, really quite significant amount of energy, but it doesn't want to do anything. It's not driving me to do anything. And I actually found out that I can do much more because I can really focus on a project. I'm not disturbed by all the other things that I think I should be doing. So again, if there are permanent changes in the brain, you would have to look at it what they are. They would not be in the direction of damage necessarily. So this was a long answer to your question.
Thank you, Shanti and Stan. And let's go next to A question from Jonas, and Jonas is asking, what can future parents do to minimize the trauma of birth?
Well, one of the things that future mothers can do, they can sort of work through on their own perinatal material. My experience has been that if a woman starts delivering, that it activates her own perinatal material. So to the extent to which there are sort of problematic emotions and you know, a lot of disturbing energies that can interfere with the process of delivery, which is autonomous in and of itself. So that's certainly one thing. It also has something to do with when we are attending to delivering women. For example, there was in the Mayan culture a group of midwives who had a sacred secret society, and to become a midwife, you had to go through a powerful rite of passage where you work through your own perinatal experiences, because it was seen that this is necessary so you can fully focus on supporting other women in the birth process, rather than getting your own memories activated. So that's one thing. The other thing is, you know, the way you run the birth. So only small % of the deliveries needs any kind of a surgical intervention from modern medicine. Does not necessarily run 100% of the deliveries in a operation room, which we have associated with you know, disease. There's also not the nicest environment with the bright lights, with the noises, the paging, and whatever else might be happening there. So you can create your own environment for birthing. You can get a backup and do a home delivery. You know, you can bring a tank with a thermostat and do a birth delivery and have the backing of a midwife or an obstetrician, and also, you know, be prepared when something goes wrong, that you can get fast to a hospital. Some hospitals now offer special arrangements where you can still be part of the hospital, but create your own situation. You can invite your friends if you want, and you know, you can do drumming and chanting and do it as a ritual. So that's another thing. You can completely change the birthing situation. The underwater birth is certainly extremely important because the fetus is coming from one aquatic environment into another and can exist for quite a while underwater, really still getting the oxygen from the placenta. So in close contact with the mother. So you recreate a situation that's almost like the womb. So it's like from one womb to another, and the message is, you know, things got rough there for a while, but now you're okay again. You're back in a comfortable situation to create the pregnancy was good. So that's an important thing, you know, the husband being part of it. There's a very numinous quality if you take it out of the busy kind of a obstetric environment and treat it more as a you know, as a ritual event. It has to do with the bonding that you can allow in that situation. There are basically two sets of hormones that are involved in delivery. Michel Audin wrote a book and also lectured about it. One group of those hormones are the catecholamines, the adrenaline, noradrenaline. They are associated with the stress of birth, with the delivery itself. And in terms of the evolution of species, it also had the function of bringing in the possibility of fight or flight. if the females were delivering in nature with a lot of blood, that would attract predators. So there was also the function of the catecholamines to mobilize for fight or flight. But there's another group of hormones, which is like the oxytocin, the endorphins, and the prolactin that are involved again in something that's extremely important in terms of the survival of the species, which is creating of the parenting behavior of the parents. And these two groups of hormones are in competition. If you mobilize too much the sort of flight and fight response, if you create a scary situation around the delivery, that it's at the expense of the bonding that is happening. So these kind of quiet ritual type of deliveries that are now, you know, quite popular in California, for example, they can really have something to do with creating a sense of trust that the child is bringing into the world. Michelle Odan, who wrote the book, talked about how these circumstances of birth can cultivate either aggression or cultivate love, depending how the whole birth is conducted. And the other thing, of course, you know, natural nursing. Many women in the industrial society have been brainwashed by advertising that to give a formula is better than mother's milk because it has the right kind of amount of vitamins and minerals, you know, which I think is a problematic advice. So those are things that can, you know, have a very important role here. And of course, the critical importance is the relationship that the parents have, you know, how they interact with other, the level of intimacy, ability to communicate, and so on, and to what extent they really are looking forward to the child. The child comes welcome. Albert Einstein was interviewed by a reporter, and at one point the reporter asked him, Professor Einstein, if you had just one question to ask about the universe, what would it be? And expected that he's going to come up with something like a universal constant, you know, some kind of formula equation. And Einstein was thinking, and then he said, it would be, is the universe friendly? Now, this obviously has to be the question of the fetus that's emerging into this world. You know, where am I? Is this a friendly environment? So how we handle that is a major imprinting of a positive or a negative image. To what extent the pain and the comfort, the satisfaction of what's called the anaclitic needs of the fetus are satisfied. The need for close physical contact, for being, you know, loved, not having sort of sense of satisfaction, feeling helpless but safe. So those are all things that would be very important. But again, the medical profession and psychiatrists have to first accept that birth can be a major psychotrauma, and then think that we are doing around have psychological impact on the whole life of the individual. That it's not enough to check the blood groups and count the fingers and so on. And if everything's physically okay, we feel that we have done our job. We are really shaping the whole personality of the born individual. Okay.
Okay, thank you, Stan. Are you ready for the next one?
Yes, I am.
All right, here we go. So this question comes from an anonymous viewer, And this anonymous viewer has their first breathwork workshop coming up in a week and says, I had one psilocybin introspective experience 1 year ago where the most significant feeling was a strong but passing fearful sense related to the thought, I'm not good enough.
Sorry, I'm not getting it. What was the feeling?
Okay, the feeling was a strong but passing fearful sense related to the thought, I'm not good enough. And then goes on, the question is, can you offer your best recommendation on how to integrate this or use the breathwork session to deal with this, or how to best prepare for a successful breathwork session?
Well, I already addressed this issue of feeling not good enough, feeling inadequate in some sense. There you would look at what was happening in your childhood. How were you brought up? How many positive feedbacks did you get from your environment? Were you primarily appreciated for what you did well, or were they focused on eliminating what you did wrong? Which something that would shape your self-image, because you would hear about yourself mostly positive things or mostly negative things. Both of those approaches can shape behavior. You can do things because we want the positive feedback or because we want to avoid negative feedback. But many parents and certainly teachers don't realize that they're also shaping the self-image. So you might find a co-ed system that somehow brings in together experiences from different parts of your life where your self-image, self-esteem was somehow questioned or damaged. And then the deeper level, as I mentioned, is in the birth canal, particularly the third matrix, where the child is exposed to a situation which is overwhelming, which is so taxing that it's way above what this very frail organism can reasonably handle. So there is a sense of helplessness, of inadequacy on a very deep level, but at the same time, they're not being able to breathe, and life is threatened. So there's a tremendous urge to get through, get over it. So that is the Adlerian axis of feelings of inadequacy and tendency to overcompensate it in some way. So you could find some of the feelings of inadequacy really on that level as well. Now, the best preparation for the breathwork, for example, is to know something about it, to know particularly the cartography, that it can take you to birth, that it can take you to past life, it can take you to the archetypal domains, and that this doesn't mean that you are psychotic, that these are normal ingredients of the unconscious. And then in the session itself, just stay with the process. Don't bring any kind of programs. I want to work on that feeling of not being enough. Just sort of trust that the self-healing intelligence will find spontaneously what you need to work on, and also what is available in a particular session. In a particular session, the holotropic state reaches the material which has strong enough emotional charge, is significant, but also is in a certain position to the threshold of consciousness. In other words, it is ready to be processed, it's ready to be worked through. And so just surrendering to the process and going with the experience, even if it taking you to places that you don't understand what's happening, really trust and let that process guide you. This would be, I think, the fastest and the most effective way of using these states.
Okay, thank you, Stan. That's a wonderful question and response for everyone. Leanne is asking, is holotropic breathwork something you can do on your own, or do you need someone to guide you?
Well, generally, I would say it's not a good idea to do it alone. And you know, I have to answer it this way because I don't know what you are dealing with, what your emotional situation is. So to give a yes or no answer is not really possible. Generally, if you are beginner, if you have never done it, definitely start in a group led by somebody who is properly trained. You can get a list of the people who have been trained, close to 2,000 people all over the world now. You can get it from holotropic.com. And then definitely start in a group led by somebody who is experienced. Now, if you have done quite a few of those sessions and you know your response, then you know, you might be able to continue on your own, but certainly not beginning that way. Now, there are many reasons for it. It's very easy to get into an unorganized state by breathing. But once you are in it, that takes real experience to deal with what's coming up. So if you be reliving birth or something, it can be really taxing, a scary situation. So you need certainly support for it. If you get to a situation where you're experiencing episode of abandonment in childhood, or you were born premature and you spent 3 months in an incubator with no positive contact with your mother, then you also will need kind of a support, physical support for that. And we'll get more about it when we get to the issue of holotropic breathwork and also the healing intelligence itself. Now, you also might end up in a situation where something in the body got not finished, and a good body work is necessary for a good closure of the session. You would not be able to do the body work. So both the support in some kind of really intense, overwhelming situation, then the physical nourishing support if you're dealing with states of abandonment, and then body work, releasing body work in case something in the body remained unresolved.
Okay, thank you. Let's go next to Lawrence. Lawrence asks, what is the impact on the perinatal matrix on performing an external cephalic version on a breech pregnancy? What is the impact of a breech birth? Are there any particular traits to such a birth?
Well, generally, the breech birth would be more difficult than your average head first delivery. So you would probably have to deal with more painful, difficult experiences than if it was the head first situation. You would also see a different pattern. For example, people who were born head first, when they are reliving birth, they ask for resistance. They like to push with their head against pillows and so on. Whereas in a person who was born as a breech birth, you see a lot of activity in the lower part of the body, a lot of activity in the legs and the feet. And so you would be doing some, if you are supporting it physically, you would be doing more work on the feet and less of the giving the resistance to the head.
Okay, thank you, Stan.
Mm-hmm.
Let's go next to, okay, so the name is, it looks like Bind, asks, can holotropic breathwork be used as a tool in Kundalini cleansing process?
Well, in the Kundalini process, you already have the experiences are already happening. So you can just be there and support the person to express it. You might do body work if the energy gets blocked. very common blocking places for the Kundalini, for example, in the small of the back between the shoulders, then particularly at the bottom of the skull. Those are very, very common areas where the Kundalini energy is blocking. So this focused body work can help sort of to take the energy through those blockages. And if you want to intensify that process, certainly the breathing is something that would intensify it further if it needs to be intensified. But very frequently the process is so intense that all it needs is the encouragement, somebody being there with you and give you reassurance that it's okay, because people may be very scared by where the process is taking them. So they might for a while work on your own trust and confidence. But if you feel that the process has to be even intensified even further, then you can certainly use the breath work to help it.
All right, and let's go to our next question. We have just about a little less than 15 minutes left, so let's go to Fran next. And I'll invite those of you who would like to come on live on audio to raise your hand, and we do probably have one more time for a live question. So Fran asks, what is your perspective regarding whether or not unconscious material must be explicitly expressed as opposed to implicitly in order for resolution of the consequences of the unconscious material?
Can I hear more about what it is to resolve something implicitly?
Okay, so let's see. So Fran, if you could write in a little bit more.
I'm not sure I understand what it means.
Right, we'll just wait for a little bit more information. Okay, well, while we're waiting for Fran.
Accepting that the material is there, or knowing that it's there.
Okay, and while we're waiting for more from Fran, let's go to Belen's question. And Belen asks, do you consider that there is a difference in impact, psychologically, energetic, and spiritually, between using a synthetic drug, such as LSD, compared to a living plant or elemental like ayahuasca?
Well, it's very difficult to give a very clear answer to that. My intuitive feeling is that it makes a difference to work with plant materials. If you believe in something like the morphogenetic fields, as Rupert Sheldrake talks about it, the fact that not only it comes from nature and so on, but also the fact that thousands of people have already taken it. If you work with ayahuasca or peyote and so on, the magic mushrooms, this has very, very long history. And according to Rupert Sheldrake, this should facilitate the way you work with it and the way you utilize that. So that's one important aspect of it. Some of the substances, like the amphetamine related, they have, for my taste, a lot of side effects. There's still the peripheral amphetamine effect that it's good to block, by the blockers, sympathetic blocking agents. And then you get into too much of the chemistry. It seems to get much more artificial. Whereas this is certainly not true about the mushrooms or peyote. Now, LSD this is a complicated situation. LSD as such is not found in nature, but a substance that's extremely close is. Albert Hofmann analyzed the morning glory seeds, which is an old pre-Hispanic psychedelic called Ololuki in pre-Hispanic America. And that turned out to be what's called LA32, which is a monoethylamide of lysergic acid. It's different just from one methyl group. And so seeing that, Albert Hofmann felt that LSD actually belongs to the group of the pre-Hispanic, natural psychedelics. So LSD is not synthetic, it's semi-synthetic. You can take the lysergic acid from the ergot and just adding one CH3, one methyl group, and you are from a natural alkaloid to LSD.
Okay, thank you, Stan. And Fran just added, so I'll read her question again and then I'll let you know what she added. So she asks, what is your perspective regarding whether or not unconscious material must be explicitly expressed as opposed to implicitly in order for resolution of the consequences of the unconscious material? And then she sent in, yes, that's right, knowing that the material is there.
Yeah, knowing that the material is there can help. If you remember, if you watch the slideshow, for example, I was showing one of Hans-Rudi Giger's paintings showing the mother and the child caught in a situation where they both were suffering and couldn't escape. He called it the stillbirth machine. And I mentioned that this relates to the situation where the delivery starts and the mother and the child are now put into a situation where they are hurting each other. The nature puts the child and the mother in an antagonistic situation. The mother is taking away the comfort of the womb from the child, and the fact that the child is coming out and it's in her body, in the reproductive system, is causing a lot of pain to the mother. And many people who had that experience really changed their feelings about their mother. They realized that not all the negative feelings that they carry towards their mothers come from some situations where she had a choice. She did something bad to them, and she had the choice what she would do. She could have done something else. And just to realize that there is a situation where the hurting the child is a spin-off from a life-giving process can change it very much. So it changes some, even just the realization, even if they don't complete it, if it doesn't really fully emerge into consciousness, it's not emotionally processed, it's not physically processed. This can do something, but yet when they complete it fully consciously, that can very radically change the relationship beyond what just the awareness that something like this is there would do. Thank you very much.
Yes, thank you all for these wonderful questions. So this may be our last question. We may have time for one more. We'll see how it goes. Okay. Christina asks, she says, hi Stan, I'm a big fan of Giger, and last week,
Giger, they pronounce it Giger.
Thank you. Class last week has helped me see his art in a new light with more awe and wonder. Since most of his art is around BPM 2 and 3, did Hans have a particularly difficult birth? Did he do a lot of psychedelics? How was he able to access these deep layers of the psyche on a regular basis to create years and years of art?
Well, I haven't had really access to his birth records to know what it was. There was not in the in the family lore, there was not a report about the particularly difficult birth. But he definitely had access to it, whether it was coming from his birth or the way it was accentuated through the postnatal experiences, or whether there was some kind of an input that was even transpersonal. Those are all possibilities. But I mean, he is now dead, so I think I can say that he did psychedelic experimentation, and that he actually opened up this perinatal level and did not really resolve it. So whatever material was there was very close to the surface, which gives it particular power. And he was very, very aware of the fact that he was in his art tapping the birth trauma, and he actually saw it as healing. He didn't have quite the knowledge to go back with higher dosages and complete it, but he had the feeling that the art was healing for him, very much like Francisco Goya, the Spanish painter, who had very frightening experiences, and he said that when he put it on the canvas, he had some sense of getting command over it. And Hans Ruedi was very similar. It was also what was amazing that when he painted these gigantic canvases, he had no idea what would come out. He had no sketches for it. He started in the upper left corner, aimed the airbrush there, and pushed the lever on it, and it started creating itself. So he was basically channeling it. You can hear about it in a wonderful video, which is called The Dark Star, when his agent and his relatives talk about him and his way he created. So he was really really pouring his unconscious, through the art, through the airbrush. And at the same time, wonderful symmetrical paintings came out of his activity at the end. Now, I chose his art. I don't know if you saw. I think we gave you as a bonus it's like not a complete, but a good part of the manuscript of my last book, which is called Modern Consciousness Research and the Understanding of Art, where I talk about the fact how if you include the perinatal level into your cartography, how you will understand art much, much deeper, and certainly also the transpersonal level, than any attempts that have been done by psychoanalysts to explain art from childhood. And I actually use it in a kind of a desperate attempt to show the academic circles that there is a perinatal area in the unconscious, because the birth is still treated as something that has no relevance. It's not a psychotrauma. So I don't know if somebody doesn't see the perinatal domain in Hans Ruedi Giger's art, I don't know what would have to be presented for that. And I think it's extremely important because the perinatal level is a source of enormous amount of aggression. So there's no way of understanding what we see in the world, what's happening in the Middle East, in Syria, what was happening in Nazi Germany, what was happening in Stalin's Russia, what happened in Tibet. These are not violent impulses that are generated by unpleasant nursing or troubles with toilet training. I mean, those are life and death sort of very elementary energies. And so then, birth, particularly birth lasting number of hours, that can generate this amount of kind of biological fury that can then be unleashed either in the battles, in the war, in the revolutions, where you get not only permission, but you are sort of pushed to express it, to manifest it. And what also manifests in this PTSD, when you open up these levels, it's not just the trauma from the war, but it's also now the release of the forces that hold the perinatal down. And then when people, people come home, then they can have episodes of powerful memories, which are not the memories from the war, but they're also memories of birth, and they frequently lose it. They take a weapon and they go and start indiscriminately shooting. And unless we know what we're dealing with, unless we understand where it is coming from, we will not be able to deal anything with it. We have to identify the problem. And fortunately, we have now in these powerful experiential therapies, we have a way of transforming that aggression. People become much more peaceful. They develop feelings of compassion when they do some really intense work on their perinatal material, not just the biographical material. So anyway, thank you very much for the question.
Okay, and thank you very much, Stan, for another wonderful Q&A. And our next Q&A will be on February the 14th on Valentine's Day. So we're looking forward to being with all of you again. And Stan, I'll just turn it back to you for a moment to give any closing comments and remarks and to wrap up our call today.
Well, I'm very, very impressed by the quality of the questions. It seems to be coming from people who have done some significant work on themselves, and I will be very, very happy to provide all the material from the years of working with clients and learning from them for the people on their own journey. So I hope this is not sort of a program that's motivating people to do things that they shouldn't be doing, but give them some insights and some guidance of what they have done or have been doing already. Thank you very much.
Thank you very much, Stan, and thank you to all of you.
To our next encounter.
Yes, until our next encounter. Yes, thank you so much. And just to let everyone know, we will be back again with Stan next week, next Tuesday, for the basic perinatal matrices and prenatal memories class. So we're looking forward to being with you again then. And again, our next Q&A, mark it on your calendars, will be on February the 14th. And we look forward to another lively Q&A. And as Stan mentioned, your questions are just brilliant and wonderful, and we look forward to being with you again soon. So on behalf of everyone at the Shift Network, have a beautiful, beautiful week.